Going from broken to broke, that is what Fortune senior editor-at-large Shawn Tully has to say about the latest health care reform. Let's bring him in and talk about this bill that is really making history, certainly in this country. And your take on it, first off, is there anything in this legislation, and you have dug through the numbers time and time again, that you like about this legislation that makes financial sense to you, or all out do you think that it's the wrong economic model for this type of reform?
One of the things that potentially was a good idea was to tax high-cost plans, because that would have led companies to cut back on the very expensive health care that they provide employees.
Taxing the insurance companies.
No, not taxing insurance companies, taxing high-cost health care plans for individuals
who
are covered by...
essentially a tax on insurance companies that would assume to be passed down to the consumer.
That's correct. But the consumer eventually would have had to pay it, so companies would have had a tendency to drop those plans or cut back on the expense of those plans, give the employees more money, which would have led to a tax windfall to the government, and then people would have been more conscious about what they spend on health care. Unfortunately, that idea has been put off until 2018 under the new bill.
And that's important to note. It's included in the legislation, but it doesn't kick in for 8 more years.
It's not going to happen because the high-cost excise tax is very, very unpopular with the unions. Therefore, if you can't do it now, why can you possibly be able to do it when Obama is out of office in 2018? It's not going to happen. So therefore, the biggest source of revenue that's supposed to support the bill and decrease deficits outside of the 10-year window that the CBO scored is not going to happen. Therefore, you're going to have a bill that's anything but deficit neutral and anything but tax and spend neutral.
I do want to come back here and push you on the point of cost, because it's clear that this bill is expensive. It's clear that health care reform is expensive. What's also clear is that Americans, millions of them, tens of millions of Americans without health insurance, is also expensive to this country, incredibly expensive. Hospital visits, emergency room visits, care when people cannot pay for it, when there's not insurance, that's also expensive. And starting in 2015, Americans, if they don't have health insurance, will be charged at least $325 a year out of their pockets to pay for it. So, there is that issue of cost, isn't there, Shawn?
Well, the problem with the penalties are they're too low. In other words, they were gutted in the Senate Finance Committee because of objections by Olympia Snowe. Right? So they're too low. So what happens is, under this bill, it imposes what they call guaranteed issue and community rating on the whole country, which are what we have in states like Massachusetts, New Jersey, New York. What does that do? If someone's real costs for health care and they're healthy and they're 25 years old are $1,000 in Pennsylvania, which doesn't have community rating, they go to $5,000 in New York, which does have community rating. They're paying 5 times their actual cost. They will pay the penalty and they will not be insured. This plan will not insure any more people. We already are covering low-income people with Medicaid.
You say that this will not insure any more Americans?
No. And the reason it won't insure more Americans is because young people, because of the increase in their premiums, will drop out. So you're going to have a lot of healthy young people who are not going to be insured. Unfortunately, this has been the effect.
They
in
will
states
be allowed
that
to stay
it.
on their parents' insurance plans until they're 26
until they're
years
26.
old.
Yeah, if their parents are insured, sure. But in other words, what happens is when one of the biggest problems with now, obviously, if you have sick people who are uninsured, you got to have with pre-existing conditions, you have to have high-risk pools. You have to take care of those people, which we now have in many, many states. There should either be a national high-risk pool or subsidies towards state high-risk pools.
Well, and it's what we have from the legislation.
Well, we have a high-risk pool temporarily before we go into this full plan. But we really should stay with high-risk pools to take care of the people who really need it, use the subsidies for those purposes, and then what we should do is we should allow people to have high deductible insurance and to take the money that is now paid on their behalf by the companies and buy their own plans.